today I'm going to be talking to you all about PRP. It's a non-invasive surgery procedure that's relatively new to the medical field. I basically interned with Texas Sports Medicine for 3 months over last summer and kind of learned more about this from Dr. Villard. He is a physician that performs these surgeries for the Texas Sports Medicine group and even works on some of the basketball players for the Mavericks. So the PRP, or platelet-rich plasma, is a procedure that they take blood from either your bone marrow or fat cells, depending on the specific procedure. It's different for each, and they spin it down and put it into the affected area to help heal. The white blood cells in your plasma help heal tendons faster than maybe a surgery and help you recover quicker. So the procedure is pretty easy and, like I said, non-invasive, which is a very big bonus to it. They start off by cleaning the area that they're going to inject. Then they draw about 15 to 60 milliliters of blood from either your fat cells or your bone marrow, and they put it in a centrifuge and spin it down. Usually takes about a minute or two. And the centrifuge separates the blood from the plasma, and then they take that out of the centrifuge and use a needle to just get the white blood cells, because that's where all the healing power is. They then wipe down the area with alcohol, and then over that they put like a numbing cream such as lidocaine, so you don't feel anything. They then usually use a ultrasound machine to get right in the area so they can figure out what the tendon is, so it's like right where you need it instead of just sticking the needle in there. This helps you be more precise in the healing. Then they inject the area. It's a slower process, so they do it like 10 milliliters at a time. Then they take the needle out, clean up the area, and put a bandage on it. So it's very quick and easy. So I'm going to show you a little 30-second video of kind of the basics.
Repair your tear with surgery-free medical care. Have no fear, your body can heal. Instead of opting for surgery, we believe in using your body's natural healing factor found in your own blood. What's more natural than your own body? Accelerate your healing with platelet-rich plasma at Performance Spine and Sports Medicine. Platelet-rich plasma, or PRP, contains healing components that are derived from the patient's own blood. Platelets are cells in your own blood with growth factors that can accelerate healing and can help heal chronic injuries. They are extracted, then re-injected into the damaged area to expedite the healing process. PRP is performed under direct visualization with ultrasound. No anesthesia, no lengthy recovery. Same-day in-office procedure with greater range of motion and long-term relief.
Okay, so that was just kind of an outline of a very short video of what it's all about, kind of what I just explained to you. Now I'm going to kind of talk to you about the benefits that go along with PRP and how it's kind of growing in the medical industry and kind of preferred over surgery. So the first benefit is it helps prevent chronic pain and injuries, such as like back pain and stuff. It helps prevent arthritis and kind of keep arthritis and osteoarthritis intact. Helps calms it down. Helps with injuries such as plantar fasciitis, knee problems, shoulder problems, any tendons really that are torn or even partially torn. It helps heal those. Helps reduce lower back pain, and kind of a thing that I didn't know because I did the sports medicine side of it. It also helps with hair loss, so balding or anything like that. Helps inject hair. Helps regrow hair. Another big factor for the PRP is the cost factor, because 3 treatments, you do them every month, so every 30 days, is $2,500 normally, around $2,500, whereas surgery can be anywhere from $5,000 to $15,000. So you're saving a lot of money, and the treatment can last, it'll last at least a year with the PRP, but it can last a lifetime depending on the patient. So that's also really good, because the surgery, you're going to be out at least a year. So that's another really good thing. Doctors say that when you get a PRP shot, you're back up doing physical activity almost immediately. Whereas, like I said, the surgery you can be out for a year depending on if it's an ACL tear or something serious. So overall, the PRP is it's on good tracks to be very successful. Right now, it's in clinical trials to get approval for insurance. And once it's approved by insurance that it helps, I think it's going to take off and really replace a lot of surgeries, especially in sports, just because of the healing time, the cost, and it's non-invasive. So that's how PRP, and look for it in the future for any of your injuries. Thanks.